Hello and welcome to the Society with Fatma Shaheen at PTV World. October, as we all know, is celebrated to be Breast Cancer Awareness Month, which is why today on our show we'll be talking about the same. Overall, it's very pertinent to mention at the very outset that when it comes to Pakistan, there are findings, rather reports to suggest the fact that Pakistani women are more prone to having not only a more aggressive form of breast cancer, but also, develop this form of a cancer at a younger age, which is why it is very important to then sit back and analyze the very importance of not only talking about the disease per se, but to also equally focus upon its early detection, of course, its early diagnosis too. Overall, today on our show, we'll not only be talking about breast cancer as it does exist in the Pakistani society, but we'll also be shedding light upon the impact it then has on individuals, on their families, rather at the society at large as well. We'll be talking about the real life struggles, the highs and of course the lows of various breast cancer survivors who have successfully battled this disease and of course who have turned out to be the heroes of their own stories too in this regard. We'll also be shedding light upon, of course, the need for there to be greater community awareness, the need for there to be greater media engagement when it comes to creating maximum awareness about this disease. And last but not the least, we'll also be talking about the role of the educational institutions here, the role of the Pakistani government here when it comes to overall working towards not only effective prevention, but also by that virtue early diagnosis and definitely overall improve, the treatment process itself too. All of this today, that too with an extremely eminent panel. Let me introduce you to my today's panel. My first panelist for today's show is Ms. Fariha Faisal. She is a cancer survivor alongside being a motivational speaker. Assalamu alaikum ji and welcome to the show. Thank you for joining us.
For inviting.
Thank you for joining us. Alongside her, I have Mr. Umar Aftab, who is the CEO of Pink Ribbon, and he's also a social activist. Assalamu alaikum ji and welcome to the show. Thank you for joining us, sir. Via telephone line, we'll be joined by Dr. Huma Majid Khan. She's a consultant oncologist. Assalamu alaikum ji and welcome to the show. Thank you for joining us. And via telephone line, we'll also be joined by Ms. Nadia Jameel, who is also not only, as we all know, a breast cancer survivor, either a thriver too. She's an actor, she's a motivational speaker, child protection activist, master practitioner, and also an MB training life coach. Assalamu alaikum ji and welcome to the show. And now, before we start the discussion on today's topic, let's have a look at this brief report.
Breast cancer awareness is more important than ever, and early detection can save countless lives. Regular screenings play a vital role in catching cancer as its earliest stages, offering women the best chance at successful treatment. While a breast cancer diagnosis can be emotionally overwhelming, the power of resilience and mental strength often shines through, with many women finding hope and courage during their journey. In Pakistan, despite financial challenges, numerous healthcare initiatives are emerging, ensuring more women have access to affordable treatment. Family and community support remain essential, lifting spirits and helping women recover both physically and emotionally. Lastly, breaking culture barriers is empowering women to speak up, share their experiences, and spread breast cancer awareness, creating a future where no woman fights this battle alone.
Welcome back from the report. Now, to get the conversation started with you, Dr. Huma, first things first, when we do talk about this rampant social issue and, of course, disease of breast cancer at a very basic level, how would you explain its causes to be? We do understand the fact that scientifically speaking, we cannot pinpoint towards one particular reason, but overall, how does any person's lifestyle, their age bracket, even to some extent their family history actually dictate the chances or likelihood of developing this disease? How would you comment on this?
You are right when you say that it is multifactorial. There is like a strong link with certain genes, but it is only seen in about 5% of the patients. In vast majority of the patients, we cannot even pinpoint what is the cause. A strong family history is very, very important, but not as important because only about 10% patients have that. In a vast majority, we do not really know what actually triggered it, but there might be contributory factors like obesity, we know, like people who are overweight, who do not exercise, who smoke or drink. or have an indiscriminate use of hormones or hormone replacement therapy for a very long time, they all have a higher risk of developing breast cancer. Women, if they have their first child before the age of 30 and breastfeed their children for at least 6 months, they have a lesser chance of developing breast cancer. But at the same time, remember that women who have too many children without much space and who are continuously are either pregnant or breastfeeding, their chance is not actually decreased and it's most probably increased. Then a good bone health, again, exercise helps in developing that. And a good sleep and less stress, all these things contribute to a good health and a good immunity against this disease.
Right, madam. On which I'll come to you, and I would want you to add to this further. So we do understand that your mother is also a breast cancer survivor, and then you've also, suffered from cancer per se too. So overall, when it comes to having those kind of attitudes towards battling cancer, did your mother's having cancer in ways more than one make you perhaps more aware, more cognizant of the disease than might have been the case in the event that she didn't suffer from the same disease? Because you did come from that environment where you did see her ordeal per se.
My husband was involved in all the treatment, but when it comes to my mother, then my father and my brother, they also involved in this whole treatment. So whenever I go to any seminar, so I will discuss about my mother disease now as well, because it's important especially for the male members, that they should know about this disease, because when it comes to your family, then you have to discuss it with everybody in the family.
With the entire family.
Regardless of any embarrassment and anything, but you have to discuss the disease. So it's very crucial to communicate in a proper way about the chemo, about surgery or any other treatment regarding to all of this treatment, because we associate this disease with a lot of shame.
Unfortunately, stigma as well.
Yes,
right.
and we don't want to take the name of this word cancer itself.
Right. Although over a period of time, Ms. Faria, we do understand we have been able to defy that level of stigma and socio-cultural stereotypes which may exist around the disease. Sir, I'll come to you. I think here she's mentioned some very valid points, that when it comes to involving male allies, it is extremely important to do just that. To understand that you've also been very persistently advocating for this cause as well. So how do you, in the course of your advocacy campaigns, how do you in the course of even service delivery, then involve the average Pakistani man out there?
So as you know, we are a patriarchal society. It's very male dominated, and all the decisions are being by the male. Even the decision of going to a doctor, which hospital. So all the decisions are being done by male. So we realize that whatever awareness we try to raise in women, till the time we don't engage men, it's very difficult to break these barriers.
True.
And then also in terms of, if we see health, there is a gender dimension of health. It's at the society level, it's at the household level, it's at the state level as well. Because if you see those diseases which are more common for male and female, the facilities are very different as compared to when we see those diseases which are only female-led. The facilities for those are different. So,
of course.
And then overall, I think the mindset of the society, because for example, unfortunately, we see that most of the breast cancer patients, the attendant with them is either the father or brother, son. Husbands are mostly, unfortunately, missing generally.
Right, sir, your point is noted. On which I'll come to you, Ms. Nadia, and I would want you to add to this further. So overall, when we do talk about the diagnosis of breast cancer, a lot of times we see that in Pakistan at least, doctors, they might end up advising the clinician so as to perhaps undermine the gravity or the seriousness of the disease, perhaps not tell the patient the true, give them the true picture, so to speak. So when it comes to, not only informing the patient but also directly involving them in their respective treatment plans, how do you propose should that be done, and why is it so important then to also safeguard the patient's wishes and of course respect their respective autonomy, at the same time ensuring that they do not end up losing hope, because this is a very fine balance to maintain at the end of the day.
I think it's very important to treat, I mean, if this is assuming the patient is an adult, to treat the patient as an adult and respect them being an adult and keep them in the loop. The way I was told from the very onset, I was warned, okay, this is looking suspicious because so right from the very onset, I was sent to the breast clinic, and the GP sent me to the breast clinic because I was diagnosed in Cambridge, and I was told this is suspicious, let's do a biopsy immediately. And then I was taken to a room when I was informed about the biopsy report, a very comfortable pink room, and I knew by how nice the room was that the news is going to be bad. And then they sat me down and they said, it is unfortunately cancer. So they didn't say it is bad news. I think there's no need to anchor that language into the patient's head that it is bad news. I mean, it's a given, it's a bad news. So I think I'm glad what the language that was used was simply that it is cancer, unfortunately. And the next step is the plan which oncologist will, draw out with you. So I was immediately taken into the strategy part of it. Just be honest. I think be honest, be clear, be concise, don't ramble on too much about it, and don't use negative language around it unnecessarily. It is negative enough as it goes. As far as losing hope is concerned, I think that is up to the patient. The patient has to decide what attitude they want to go into the sickness with. And your attitude is very important. It's very important. And I think it's important to explain to the patient that their attitude is going to be important. How they're going to perceive this, how they're going to deal with this is going to affect the treatment.
On which I'll come to you, Ms. Faria, and I would want you to add to this further. So generally, she has raised some very valid points, the focus of which is then, of course, to ensure that we all then adopt a very patient-centric approach, which will not only help us improve the treatment outcomes, but also in turn, improve the patient satisfaction rate too. So when it comes to your own personal experience, how patient-friendly, how patient-centric did you find the healthcare system to be, whether it was in terms of perhaps getting your various treatments done, chemo or otherwise other therapies, or whether it was in the way you were then dealt with by healthcare professionals?
So basically, I was blessed that I had very good doctors around me. So I got the best treatment which was available at that time. So now the treatment is very advanced, so we have more options right now.
Right.
So, and it's very comfortable for me around the staff because you are very fragile at that point. So you need, that comfort and, that care from your surroundings, from your caregivers and from your doctors as well.
So true.
So I had the same experience with my mother as well. So we again got the best treatment and best health options available at that point. So I would obviously regarding the patient, because it's the battle of the patient as well. So I believe the willpower is very important. So how much you are able to, take this disease and want to live your life.
Right.
So there's a fear of unknown attached to that.
There's a lot of uncertainty there. So it goes back to having that right mindset. I think this is something which Nadia also just mentioned. So when we do talk about this, we also understand that, you've moved a step past that. You are also very actively engaging now with educational programs, awareness sessions, so as to educate people about breast cancer, more particularly women. So how did your own experience of being a breast cancer survivor otherwise actually influence you towards such advocacy campaigns?
So because there's a big gap between the society. See, as I told you that we are not talking about the word cancer itself. So being a survivor, it's again very challenging. People name you with different, like this is the punishment of your sin. So I just came out of that first, and then I just start talking about my story that encourage a lot of people to talk about their story. And again, it's a matter of hope, that which Nadia Jameel also mentioned, that it's a matter of hope. So I think if we are talking about, the survivors are talking about the disease itself.
It gives people more hope.
Yes.
And also not only hope, I think here what's very important to mention is the narrative which is then being set. You shouldn't just portray, people people who have suffered from the disease itself and who are survivors today, rather thrivers, people like yourself and Nadia Jameel herself, as people who've perhaps being victims of mere diseases. I think the narrative should change to be more positive, more strong, more empowering towards them. Sir, on which I'll come to you, and here it's equally important then to also talk about your bit of work in this regard too. So we do understand that you've been engaging with various educational institutions so as to educate young females about not only the disease itself but also about the importance of self-examination. So how are all these educational workshops, these seminars and these sessions actually lined up, and how do you also in turn evaluate the success of the same? Because a lot of times you might end up going to such educational institutions, but you perhaps might not have that way of gauging the success that you actually have or the impact that you've actually made. So how does this play through?
I think if I evaluate youth program amongst our different programs, I would say this has been the best program, because so when we initially started our campaign and we went to a couple of educational institutions in Lahore, all female educational institutions, some very modern educational institutions, and now we have a very extensive youth program. Every year we go to more than 200 colleges, universities across Pakistan, and we have seen that this has been the most successful initiative, because when we, for example, go to a college in some small town, it's not just that reaching out to 500 or 1,000 girls, it's reaching out to 1,000 households. We have seen that this youth program has, it played a multiplier effect, because, the girls, when they get that information and when they go home, so they talk with their mothers, with their sisters, with their khalas.
So having said that, it's equally important to also shed light upon the challenges which people like yourself actually come across in the course of conducting all these advocacy campaigns, more particularly in rural and remote areas. So what kind of socio-cultural challenges do you actually come across, and how do you overcome the same?
So first, I think the most important challenge in rural areas is that the access to healthcare, because we see that in most of our rural areas they'll hardly have basic health unit, maybe district headquarter hospital, and those facilities, they don't have diagnostic services. That's the first challenge. Then the cultural beliefs. There are lots of mixed challenges, and otherwise in terms of we reaching out to those areas. So first of all, what we have done is that government has a very extensive lady health worker program. So just in Punjab, they have more than 100,000 lady health workers. So we got included this breast cancer in their training program. They are the first point of contact. And then for last 2-3 years, I think the most effective medium has been that with the support of Pakistan Telecommunication Authority. So in every October for last 3 years, they put the ringtone on the breast cancer.
I think that is a very intelligent and extremely effective way to get through to people. But in this regard, when we do talk about this from your own perspective, you yourself have also come across quite a few women who would prefer getting themselves spiritually healed as opposed to getting proper medical interventions in place. So how do you address that notion? Because that again is a very pressing concern in our society too.
Yes, I came across a lot of cases like this. So I just counsel them that you can go for any spiritual help, that's fine, but the treatment is also equally important. And it's also written in Quran that you have to go seek for the medical help as well. So it's very tricky and very challenging to deal with such people, especially who belongs to rural areas.
And who are not educated.
Yeah, they are not educated and they don't have those finances as well. So you have to tell them from where you will be getting this treatment free of cost, first of all. And second, the treatment is very important, and in that I also shared my story and other people's story as well, that we are surviving this disease because of the treatment and all. But you can continue with your spiritual practices, but you have to.
But getting medical intervention is extremely important. Right? Ms. Nadia, I would want you to add to this further, since we are talking about not one, rather quite a few myths and socio-cultural stereotypes which unfortunately still exist in the Pakistani society regarding breast cancer. cancer. How do you, as a media person yourself, as a former talk show host, as an actor per se, feel that media then can actually educate people? How can it then, of course, make the community more aware about the disease itself, about the signs and symptoms of this very disease, and also at the same time do it in a manner which kind of doesn't scare them away? How do you propose can media educate people rather than scaring them?
I think there's zero awareness right now. There isn't enough awareness at all in the media or anywhere else. Early detection saves lives. Early detection saved my life. There's a ridiculous amount of stigma around so many topics, and breast cancer is one of them. The second, self-check is very important. It's really important to understand cancer requires there is an entire ecology, an entire ecosphere that supports cancer patients, or that needs to support cancer patients. So the family needs to be supported. The mental health of both the patient and their families need to be supported. You need to think about wigs. You need to think about positive reinforcement. You need to think about nutrition and diet. There is a whole ecosphere that supported me in the NHS while I was alone in COVID with cancer. And my child, I was with my 13-year-old at that time. So it's imperative that we develop that kind of an ecosphere. So it starts from the testing units that test whether you're positive or negative, and then the treatment, and educating people about the side effects of everything and how to protect themselves against those side effects, whilst also creating spaces for the family where the family can be given the correct kind of support, because people walk out on people who have cancer. So that ecosphere and that whole entire system is very important to develop. And unfortunately in Pakistan, we don't believe in systems. We believe in single people doing heroic acts, and we start depending on them. But that is really an idol with clay feet, because we need systems. Systems last and systems protect.
Indeed, systems last and systems protect. But in this regard, then, of course, the system should be such that it should also take, the families and the society along with it too. But moving on, Dr. Huma, I'll come to you. And in this regard, we must also, of course, talk about the lesser known but very common symptoms of breast cancer. A lot of times we see that, women, they might be rushing to hospitals, or they might be getting medical interventions when the symptoms or the signs are absolutely clear. Things are black and white. But what about times where perhaps they might need to do so, but they might very conveniently ignore the need to do that, more particularly when it comes to less educated women with little or no knowledge of medical science? So in this regard, what are the red flags you propose that women ideally should look out for, and why is it so important then to rush towards early detection, early diagnosis?
So when it comes to the symptoms or what they feel, which can be sinister, then obviously the first thing is a lump, and especially a painless lump, because in vast majority of patients, the lump is not, or the cancer is not painful when it starts. It only becomes painful when it becomes big enough to involve the chest wall or the skin. And usually by that time, it's quite advanced. The other sign of something sinister is that if the skin is pulled inside, or they start having an abnormal watery or bloody discharge, especially from one side. In later stages, they can also feel a lump under their armpit. Sometimes the lump in the breast is not big enough to basically get their attention, but they feel the lump under the armpit. These are the common things, and we have to remember that the association between pain and something sinister is so deep-rooted in us that many women basically just present late just because of the fact that the lump was not painful. And so they have to remember this. Cancer is usually painless in the early stages, so please do not refrain from going to a doctor if you have no pain but you found something abnormal. So, and that is usually why sometimes women come even with a very large mass, but they haven't really detected anything because they never examined themselves and they just didn't know what was normal and what is not.
Right, madam, your point is noted. On which I'll come to you, Ms. Faria, and I would want you to add to this further. So overall, when we do talk about the importance of self-examination, I think this is something which Dr. Huma rightly so delved upon. How would you further deliberate on it? We do understand the fact that this is something that you are very actively engaged in, especially when you are addressing, the concerns of young female high school students too, because you've been very actively engaged with education institutions as well. So how do you then inculcate this practice and the importance of self-examination in younger students, and how do you also then, of course, sit back and analyze the impact of such screenings per se?
So basically, early detection will save you from a lot of hassle, physically, emotionally and mentally. The treatment would be much invasive, much in a better way, so you don't have to go through a lot of emotional and physical pain, first of all. So early detection is that's why it's very important. And secondly, we always encourage people to self-examine, and not every lump is a cancer lump. So maybe that is a benign lump, but we need to investigate it
And you
further.
need to rule that out.
Yes, we need to rule that out.
Right. Although, it would also be very pertinent to mention here that according to stats, generally Pakistani women are more prone to getting more aggressive form of cancers, that too at a younger age. Sir, I would want you to add to this, more particularly from your own line of work. So we do understand that you've started, this very dedicated breast cancer hospital in Lahore, the aim of which is to provide free services, be it mammograms, be it OPD services, be it even consultations to the, of course, women who might need the same. So how do you then evaluate the working of this hospital at large? Because then, of course, you're just not targeting improving an average person's access to the healthcare system, but then you're also trying to, in your own way, rehabilitate that woman back into the society.
So first of all, the idea of making a dedicated breast cancer hospital was that breast cancer is 50% of the overall cancer burden. So if we have 100 cancer patients in Pakistan, 50 are only breast cancer. So one of our major idea of this making this hospital was to make a statement that breast cancer is this important a disease that we need to have a dedicated facility. Then the other thing is that we have everything now under one roof. It's just dedicated for breast cancer. It's all female staff. So you don't have to go from one place to another, because generally at some at most of the places diagnostics is somewhere else, and surgery you have to go somewhere else, and then there are
so
long
it's a one
waiting
roof stop shop.
Awareness is not converting into action as it should be, because still we feel that women coming for mammogram, the ratio is still very less.
Although in routine after 40 it is advised yearly at least.
At least in once in 2 years, so you should definitely go for that. But we, in a audience of 100 people, you would find maybe 2 or 3 people.
But
who
sir, then
just
why is that the case? Because overall we have seen that media has been giving due consideration to this issue. Then we've also seen people like yourself from the private sector, even her to some extent, advocating for it. Why still do you feel is there this resistance?
But interestingly, there is a divide in the age group. So what we are seeing is that younger girls are coming with now early symptoms as compared to the older women. I think behavioral change is a very slow process, and somehow we have seen that in our older women, they still believe that ignorance is a bliss.
On which I'll come to you, Ms. Nadia, and I would want you to talk about this. So when we do talk about the most imminent psychosocial challenges that breast cancer survivors do come across, what were the biggest challenges that you in your breast cancer journey did come across, and how do you feel did it then change you as a person? A lot of times we see that women, they might be undergoing very invasive treatment so as to fight this battle against cancer, and that in turn might have a very negative impact on their emotional and psychological well-being. So did that ever happen to you? Why is it so important to practice self-love, that too during the course of getting such treatments?
The biggest challenge I faced in cancer was not the cancer itself, but it was depression and fighting depression, and all my all the traits in my personality that I had not worked on, that I should have worked on because of whatever childhood traumas I'd been through. And we've all had some trauma or the other in our life. They really magnified and became larger than life during cancer. So mental health work is very important. Getting the right mental health practitioner to help support your journey is very important. Cancer affects not just you but the whole family. So it's important for the whole family to get support. And I think one of the problems people have is seeking mental health support. There is no shame in going to the gym to be fit and going to mental health practitioners to understand your mental health patterns and your mental patterns, your mind's patterns, your behavioral patterns. So I think that's important to work on your mental health. Yes, it was very traumatic. When my hair fell out, the night before I shaved, I was crying and sobbing. I washed my hair with rose shampoo and conditioner as if it was my baby. But I think when I shaved my head and looked at my face in the mirror, I had decided by then to look for the positive, and I just saw my beautiful eyes. And that was the first time I could say to myself that you have beautiful eyes, Nadia Jamil, and you have a beautiful smile. I would have found saying that very vain and very selfish before. But I think in that vulnerability, I learned to really like what I saw in the mirror. And I wasn't hiding behind my hair. And I realized that hair is just another, it's like a pretty bag. It's not me. It's just something I wear. And appearance is really what you feel about yourself. And what you feel about yourself is how you identify yourself. And how you identify yourself is the actions you take in life. Your actions count. Your actions are actually your identity. So it's really important to break those stigmas and stereotypes. I think my tip is, for Zuban is a big reminder to us. He says it to us so many times in Surah Rahman to make sure that somehow we understand all the blessings we have, and every breath we have is a blessing. If we're alive, it's a blessing. Our life is a blessing. Our self is a blessing. So there are always blessings. Force yourself to focus on those. And soon, practice makes things permanent. You will start automatically focusing on them. It will become a habit. It will become your personality.
Right, Nadia. I would want you to add to this further, but from your own survivor-centric viewpoint. So when we do talk about the battles that she has talked about, or about the need for there to be, of course, self-love, about the need for there to be counseling perhaps in terms of one's emotional and psychological well-being, how important is it to integrate this into your entire treatment plan? Because a lot of times we see that they might just be getting themselves treated via the various physical treatment plan options that they might have, but they might not have the right mental therapy, so to speak. So how would you then comment on this, and why do you feel is it so important then to integrate both these aspects of care into your respective treatment plan?
First of all, cancer patients stuck with their anxieties and fear of unknown, that either we'll get this treatment, we have to go through all this treatment again because it's a research-based treatment. So, but mental health is very important in this regard, and you have to work on your well-being as well, because as I am sitting in front of you, I take charge of my life, and I get out of my fear and anxieties and the depression itself as well, and then I just work on myself, on my mental health.
But did you do this, Ms. Faria, while you were battling the disease, or is this the change which has come to you post-cancer?
It is the post-cancer I deal with, because during the treatment there is a lot of things going on. But I do counsel cancer patient right now, and for them I don't suggest the physical activity, but it's more like an emotional support.
So it goes back to having perhaps a more cohesive and an integrated healthcare approach. So coming towards you, when we do talk about this more so from your angle, now we do understand that you're providing all these services to people in need of them. But when it comes to also integrating mental healthcare support, is that something that you've been focusing upon, and just not then support which goes out to people like Ms. Faria or even Nadia for that matter, people who have been cancer survivors, but also to their respective families too?
I think as we say that survivor is not just that patient. In fact, survivor is the whole family, because the trauma, the whole family goes through that trauma, and we see that the counseling is at 2-3 different steps. First of all, the counseling is that when some patient is being diagnosed with breast cancer and they don't want to come forward for the treatment, so first counseling step starts from there to motivate them that they should come for the treatment, and this is not the end of the world. Then after the treatment, for example, if there is a surgery and there is we need to remove their body part, then there is another a huge psychological trauma. So the whole process from start till the end, and then afterwards even.
Because then, this is why I put this question to her, because then you see this level of intervention should just not exist during the entire treatment process, but also post it too. On which I'll come to you, Dr. Huma, and I would want you to add to this further. So overall, when we do talk about the treatment plans and the treatment techniques, we do also appreciate the fact that over a period of time, we have seen these change, that too for the better. For example, we now generally have a greater breast cancer surgeons in Pakistan. Also, we now do generally have more targeted interventions. So how do you overall see Pakistan's healthcare system's ability improve so as to tackle and of course to fight this disease? How would you comment on this?
Most women have to basically come to the doctor and to the healthcare facilities to get themselves checked. They have this stigma of, yes, like if there's something wrong with them, what if they lose their breast, what if people know about their cancer, how will it affect their life, how will affect their social standing. All these factors do add to their late presentation, but one of the biggest factors is the economic cost and the lack of empowerment, economic empowerment in women, because somebody else has to make a decision to take them somewhere, and somebody else pays for it, and somebody else decides about what they are going to get and from where are they going to get this. So I think these things need to be addressed.
Definitely. It goes without saying that lack of financial resources is definitely a very big impediment when it comes to a woman's access to the healthcare system. On which I'll come to you, Faria, and moving towards the end of the show. So all in all, wrapping up today's conversation, what would your message be to the audience out there as, of course, thriving, a very empowered, strong woman now that you are post your cancer experience? What tips would you give to the people out there, especially when it comes to battling this disease? And why is it so important for anybody to look at their lives past cancer? A lot of times we also see that people, they end up becoming a better version of themselves post the disease. So how would you comment on that?
Go for the treatment with the hope and courage, and then comes the survivors. So I would really suggest they should talk about this disease and they should talk about their story, their success story, and whatever they had gone through during this time. So we should be vocal about it. So it will help a lot of cancer patients to survive this disease. And for the people who are, working on this cause and they are taking the responsibility, they should spread the awareness. So whenever I go to any seminar, I always suggest the people sitting there that you should please share this information with at least 5 people around you. Educate them about the breast cancer awareness, so that we have, a better understanding of the disease itself.
Right, Ms. Faria. But sir, coming towards you and to conclude today's show, so my last question to you would be that yes, we have at length spoken about the disease itself, but when it comes to not only effectively working towards its diagnosis, but also of course its prevention at large, why is it so important that people like yourself from the civil society, they actively engage with the government as well? Because I do understand that in this regard you have been working with the government, more particularly the Punjab government in this regard. What kind of initiatives are there which are underway, and why is it so important then to also look at this issue from a policy and of course from a legislative viewpoint too? We do have advocacy campaigns in place, we do have things which are then of course there so as to improve service delivery, but why should we equally focus on laws to address such issues too? So how would you comment on that?
I think this is such a big issue because more than 10 million women are at risk of breast cancer in Pakistan. So we need to have a holistic approach. And in the holistic approach, we need to see that the access to healthcare is available till the grassroots level, access to medication, because there are lots of therapies, there are lots of new therapies which are still not available, and patients, they have to fight on their own to get those therapies. So having those therapies at reasonable price, and otherwise then the most important thing is the prevention part, because so for example, we are working with the Punjab Food, Agriculture and Drug Authority, and their mandate is to see that which agriculture products, which food products, which drugs are not up to the mark, because 40% of the cancer, of breast cancer, can be reduced with lifestyle change. So,
True.
so lots of the things we are eating, that needs to be taken care of. So,
Sir, and also are you, sir, tackling this very rampant issue of, having a proper cancer registry database in place? Because that again is something that has been cropping up again and again. So are you working on this particular issue?
In last, I think in 15 years, we have made at least 3 different attempts. Now, health is a provincial subject, so we have already met with the Chief Minister, and we have proposed to come up with the legislation to collect data, because once there will be a legislation, then it will be mandatory for all the service providers to provide the data, and the Punjab Health Department will be the focal point for that. And likewise, we are talking with the Sindh government, because till the time we do the legislation, we can't get the data. And recently, we have partnered with the Center of Excellence on Molecular Biology of Punjab University, and we are starting the genetic testing. Now the genetic testing is that, so we see lots of patients who have higher, genetic risk because of their first relative having breast cancer or any other cancer. Previously, these tests were not available in Pakistan, and now we, in collaboration with CEMB, we will be doing the BRCA1, BRCA2 testing here in Pakistan, and it will be available at a very nominal cost. This is a breakthrough, because at least 10% of breast cancer patients are those who have genetic history. So now with BRCA1, BRCA2 gene testing, you can find out that do you actually have that risk transferred through your genes.
And then you can, of course, accordingly strive towards early detection and then early intervention. Exactly. This is something very important, sir. Coming towards you, Dr. Huma, and to conclude today's show. So all in all, when it comes to wrapping up today's conversation, what are the most common concerns, what are the most common queries that you as a surgical oncologist then come across, whether these queries then emanate from people, from women who are suffering from cancer, or whether these queries then relate with life after cancer, and how would you address the same using today's platform?
So the biggest concern is whether they are going to live. Yes, many patients would not make it, but then a vast majority, almost I would say 75 to 80% of the women, they survive breast cancer if they come at the right stage, and then they will continue to have a healthy, useful life. The second thing is whether the cancer will come back or not. For that, we need a survivorship program, and all good institutions have that. But remember that if you continue to have a follow-up after the treatment on a regular interval, and you continue to get your mammography and ultrasound, then there's a chance that if there is even something else which happens, it's going to be picked up early. A relapse is going to happen, or a new cancer is going to happen in only about 10 to 20% of the women, and most women do not have that. So they continue to see their doctors, and they will look after them. Another important concern is in younger women or women who do not have children is whether their fertility will be preserved or not. And nowadays there are ways of dealing with that, and they have to discuss the matter with their doctors before starting chemotherapy. Marriage is not an issue. Even breastfeeding is not an issue. Having children is not an issue. All these things need to be discussed with the healthcare providers, with their surgeon or the oncologist, without feeling shy about it, and they will hopefully come up with the right answers.
Coming towards you, Ms. Nadia, and moving towards the end of the show. So all in all, my last question to you would be that, they say that cancer survivors are blessed with two lives, one which is before cancer and the other one which is after cancer. And the second life is so much better than the first one. As a breast cancer survivor, rather a thriver in your own right, would you agree with this? What message would you give to the people out there, more particularly Pakistani women, when it comes to fighting breast cancer in the Pakistani society?
I agree. I agree that there is a life before cancer and there's a life after cancer, and cancer changes you forever. Cancer is a very lonely journey. Nobody, absolutely nobody but the person who's going through it actually understands that there's a war going on inside your body. And then the chemotherapy, the drugs that are trying to protect you and kill the cancer cells more often so are cause even more severe sickness. I mean, I got diabetes because of the chemo. Went into coma because of the diabetes. So, I mean, it's only the person going through it understands what it's like to lose all your hair, to lose your nails, to lose your eyebrows, and to face the world with strength, with your head up, in your beauty. I think stand in your beauty. Stand knowing that you're beautiful. I didn't even wear the wig. I only wore it because I got a blue wig for the NHS because of its support for me. I think also the choices I made after cancer, when I realized that Allah Ta'ala wants me to reflect, wants me to work on myself, I took the NLP practitioner course, and I did the NLP master practitioner course, became a hypnotherapist, timeline therapist, then I did the M-braining course, became an M-braining trainer. Now I'm doing the M-braining master coach course. This is not for anyone else. I'm doing it I didn't do all this to become a coach. I did this for me, to invest in myself in a focused, concentrated, intelligent way. Because that is what I thought Allah wanted from me. And it worked. I think it's because of all of these wisdomings that I am learning a lot and making the right choices and understanding the power of my choice, understanding when I feel a certain way, I'm in charge of that feeling. So all of that happened because of the journey that was kicked off in deep reflection during cancer. So take the time, I would say, take that time off as a mental vacation to just reflect and think of yourself as somebody who's healing instead of somebody who's dying. And remember that death is something that is imminent.
Right, madam. On which note I would like to conclude today's show. Thank you so much, Ms. Fariha. Thank you so much, sir. Thank you so much, Ms. Nadia. And thank you so much, Ms. Homa, for your time today. Well, to conclude today's show, we generally spoke about breast cancer as it does exist in the Pakistani society today. We also spoke about not one, rather quite a few socio-cultural norms which do then surround it, which of course do stigmatize the disease per se. In this regard, if we are serious in moving past all these socio-cultural norms, if we are serious in defying the stigma which unfortunately still exists around breast cancer per se, then we need to, of course, collectively work on this as a society. We need to not only educate people, we also need to educate young females, particularly also by that virtue, males in the society too. Pakistani media definitely has a very important responsibility vested upon it in this regard, where it should not, only ideally strive to educate people about, of course, the disease itself, but also at the same time, dispel so many myths which might otherwise surround it too. Thank you for watching The Society. Until next time, take care and Allah Hafiz.